Whereas if a patient comes in with crowns and veneers with subgingival margins and there's inflammation and you plan to redo the crowns, how would you undertake the crown lengthening first so the margins become supra-gingival? Let me not go too much into the crown lengthening because it's difficult to just describe it without the pictures or the slides. What we're going to do on the hands-on course is we're going to actually do some surgical crown lengthening on pig's jaws. So what we're going to do during the hands-on bit is when we do preps or we do crown lengthening, we'll do a very quick brief resume first of all. But essentially what you would do is you would do your crown lengthening first. So if you're replacing the restorations, then essentially you'll probably have a wax up, or if you're not changing very much about them, you'll have a study model. You can get your stent made from the study model, and your stent will be made to where your restoration margins are going to be. You'll then do your flap elevation back, and from wherever the stent is, you'll then place your bone 3 mils away from that. So that's what you'd need to do. Now, if your margins are subgingival and you don't have a stent, you would measure with a perio probe 3 mils away and reduce the bone back by 3 mils all the way around on the buccal, just going into the interproximal, but taking care not to take the height down of the papilla too much. Then you would leave that for probably at least 2 or 3 weeks before you would prep the teeth for the provisionals. You can do it on the same visit, but it's hard work. You've got to take the flap back, do your crown lengthening, suture it, then take your existing restorations off, then make provisionals, and your stitches get caught up in the bisacryl, etc. So leave it at least a week or 2. So if they're very fussy aesthetically, leave it a week or 2. And you can have a problem because particularly if they're non-vital or dark teeth, you have your veneer or your crown, then you have a dark tooth and the patients don't like it. How long would you ideally wait? Possibly 3 months or so, 4 months. But if the patient's fussy, you can go ahead to the provisionals within a couple of weeks and then leave those for about 3 months. That's fine. That's no problem.